What is radiation's impact on bone cancer strength? Have you ever wondered how radiation therapy affects the strength of bones in patients with bone cancer? Let's dive into this important topic. Radiation therapy is a common treatment for bone cancer, but it comes with significant effects on bone strength. Studies show that radiation can reduce the mechanical strength of bones both shortly after treatment and in the long term. When high doses of radiation are used, it alters the activity of bone cells. Osteoblasts are the cells that build bone, while osteoclasts break it down. Radiation can disrupt the balance between these cells, leading to decreased bone mass and deterioration of bone structure. This means that bones become more fragile and are at a higher risk of fractures. Specifically, radiation therapy leads to decreased bone strength and stiffness. Research indicates that bones that have been irradiated have a lower capacity to withstand fractures compared to those that have not been treated. Additionally, radiation can change the structure of bone. It disrupts the trabecular bone, which is the spongy part, and affects the cortical bone, the hard outer layer. Both of these are crucial for maintaining bone strength. Moreover, radiation alters the process of bone remodeling. Initially, it may increase the activity of bone resorption, which is when osteoclasts break down bone. However, over time, it leads to decreased bone formation because of impaired osteoblast function. This imbalance can weaken bones even further. Radiation also degrades the material properties of bone tissue. It damages the collagen matrix and the mineral components that give bones their strength. As a result, bones exposed to radiation therapy, such as the vertebrae, pelvis, and hips, are more prone to fractures. From a clinical perspective, treating bone cancer can be complex. Cancer cells often resist radiation, which means higher doses are needed. Unfortunately, this increases the risk of damaging surrounding healthy bone tissue. Therefore, careful treatment planning is essential. Healthcare providers may consider adjunct therapies to protect or restore bone strength during and after radiation therapy. In summary, while radiation therapy is effective in targeting cancer cells, it adversely impacts bone strength. It reduces bone mass, alters bone microarchitecture, and impairs bone tissue quality, leading to increased fragility and fracture risk. This highlights the importance of monitoring bone health and considering supportive treatments to mitigate bone loss during and after radiation therapy. Always consult healthcare professionals for personalized medical advice and treatment options.